Okay, so what I'm assessing is her occiput first. And what's happening to hers is that it's come down on the left side because she's got it verified through pain and swelling right here. So that needs to be lifted off. And then when we assess her C-spine, we're checking for some lateral flexion rotation. And I put my hands right on bones that are out of place that she can verify, right? So those are what we call corrections. So we correct those first. The patient kind of relax the neck.
Ooh.
And then we're going to the other side. These are modified rotary brakes, which is a lot. So now her spine, the C-spine is free and it's corrected.